Have you ever found yourself yawning in the middle of the day, even after a full night's sleep? Or maybe you've noticed that climbing a flight of stairs leaves you a little more winded than usual. You might just chalk it up to getting older, but what if there's something more going on? Something that's hiding beneath the surface, quietly draining your energy, dulling your focus, and making you feel unlike yourself? If that sounds familiar, you're not alone. And today we're going to talk about something that often gets overlooked in seniors but can have a huge impact on your day-to-day life: iron deficiency. Now, I know iron isn't exactly the most exciting topic in the world. It's not something people bring up over coffee or during a walk in the park. But let me tell you, understanding the signs of low iron levels could be one of the most important things you do for your health right now. Especially after 60, when your body starts processing nutrients a little differently than it did in your younger years. Iron is the mineral that helps carry oxygen in your blood. That means when you don't have enough of it, your body has to work a lot harder to get oxygen to your brain, your muscles, your organs, everywhere. And that's when the problems begin. Fatigue, forgetfulness, weakness, cold hands and feet, it's all connected. And the worst part? These symptoms often sneak up so slowly that you don't even realize what's happening until it's affecting your everyday life. So in this video, we're going to walk through the symptoms of iron deficiency that seniors should never ignore. Not in a scary or overwhelming way, but in a practical, supportive way that helps you feel more in control of your health. And we'll talk about what you can do if you recognize any of these signs in yourself or a loved one. Let's start with one of the most common signs: constant tiredness that doesn't go away with rest. You know the kind I'm talking about. It's not just being a little sleepy after lunch or needing a nap after gardening. It's that deep, dragging fatigue that makes you feel like you're carrying bricks in your pockets. You might sleep 8 hours, 10 hours, or even more, but still wake up feeling like you barely rested. That's because without enough iron, your red blood cells can't carry oxygen efficiently, so your body is literally running on low power all day long. What's tricky is that most of us just assume we're supposed to be tired as we get older. We start to accept it as just part of aging. But that's not always true. Aging doesn't mean you should feel constantly exhausted. In fact, if you're staying active, eating well, and getting decent sleep, your energy levels should still support the life you want to live. So if you're always tired, no matter what you do, it's worth asking your doctor about checking your iron levels. Another sneaky sign of iron deficiency is shortness of breath, even during activities that used to be easy for you. Let's say you've always enjoyed walking around your neighborhood in the evening. It used to be relaxing, refreshing, but lately you find yourself stopping to catch your breath, or your heart starts racing faster than usual. That's not just getting older. That could be your body struggling to get enough oxygen to your muscles because of low iron. It can also show up when climbing stairs, bending over to pick something up, or doing light housework. You may even notice that your breathing feels shallow or more labored during rest. If you've never had lung issues or heart problems in the past, this change could point towards something like anemia, especially if it comes along with tiredness or a pale complexion. Speaking of which, pale or sallow skin is another subtle clue. When iron levels drop, red blood cells become fewer and smaller, making it harder for blood to deliver that healthy, rosy glow to your face and hands. Some people also notice that the inside of their lower eyelids or even their gums look unusually pale. It's a quiet sign, but one that can speak volumes if you know what to look for. Now let's talk about something a little more surprising: feeling unusually cold. Not just chilly in the winter or when the fan is blowing, but feeling cold all the time, even when others around you are comfortable. Cold hands, cold feet, or a general sense that your body isn't warming up like it used to can be tied to poor circulation, which often happens when iron levels are low. Your body simply can't get enough warm, oxygen-rich blood to your extremities. So if you're bundling up in June or always reaching for a sweater, even on sunny days, that could be your body whispering to you that something's off. Now here's one that surprises a lot of people: brain fog and trouble concentrating. Yes, low iron can affect your mind just as much as your body. Without enough oxygen reaching the brain, you may find it harder to focus, recall names, or even follow conversations. You might walk into a room and forget why you came in, or find yourself rereading the same line in a book over and over. That mental fuzziness isn't just frustrating. It can impact your confidence and independence, and often it's mistaken for early signs of memory loss or dementia, when really it could just be a matter of iron. All of these symptoms, tiredness, breathlessness, pale skin, feeling cold, and brain fog, can seem like separate issues, but they're all part of the same puzzle. And when that puzzle points to iron deficiency, it's something you can actually do something about. Iron supplements, dietary changes, and treating any underlying issues that cause low absorption can make a world of difference. So, if any of this sounds familiar, don't ignore it. Your body is always giving you clues. You just have to learn how to listen. So we've talked about how feeling constantly tired, out of breath, pale, cold, or mentally foggy might actually be your body's way of waving a red flag about low iron. But there are still other signs that can show up, and some of them are surprisingly easy to overlook because they seem so minor at first. That's the tricky thing about iron deficiency. It doesn't always shout, it whispers. One of those whispers is something many people never associate with iron at all: restless legs or strange sensations in your limbs, especially at night. If you've ever felt like your legs were twitchy, tingly, or just couldn't get comfortable in bed, it might not be just aging joints or poor circulation. Restless leg syndrome is often linked to low iron levels, particularly in older adults. You might find yourself constantly adjusting your legs, stretching them, or even getting up to walk around just to shake off the discomfort. And of course, that affects your sleep, which only adds to the fatigue you're probably already dealing with. It's easy to pass this off as a minor annoyance, but when it becomes a regular part of your night, it starts to steal your rest, your energy, and eventually, your quality of life. That's why it matters to pay attention to even the small symptoms. They often carry big messages. Another sign that often gets brushed aside is frequent headaches or dizziness, especially when standing up quickly. Now, it's not unusual to feel a little off balance once in a while, especially if you're dehydrated or haven't eaten. But if you're finding that you often feel lightheaded or that you get headaches more frequently than you used to, there might be more going on. When your brain isn't getting enough oxygen-rich blood, due to low iron, it can trigger headaches or leave you feeling like your balance is just a bit off. You might even find that your ears are ringing, or that your vision feels slightly blurry when you move quickly. These small moments of disorientation can be unsettling and dangerous, especially if you live alone or are at risk of falls. It's one more reason to listen to what your body is trying to tell you and not chalk everything up to just aging. Now here's a more visible symptom, and one that can sneak up on you if you're not looking for it: brittle nails or hair that's thinning more than usual. You might notice that your nails chip or break more easily, or that they've become thinner or more spoon-shaped over time. Your hair may seem drier, duller, or even begin to shed more than it used to. This happens because when your body is low on iron, it focuses on sending oxygen to the vital organs, your brain, heart, and lungs, not your hair or nails. So those areas don't get the nutrients they need, and they start to show signs of stress. If you're someone who has always had strong nails or thick hair, and you've noticed a change lately, don't ignore it. It could be another quiet nudge that something in your body needs attention. You might also be surprised to learn that cravings for non-food items, like ice, dirt, or even paper, can be linked to iron deficiency. Yes, really. It's a condition called pica, and while it's more commonly discussed in children or pregnant women, it does appear in older adults with anemia too. If you suddenly find yourself constantly chewing ice or craving odd textures, it's not just a quirk. It's your body sending a very loud message that something is missing. And then there's something even more subtle, but equally important, a weakened immune system. If you've been catching more colds lately or taking longer to recover from them, your iron levels might be playing a role. Iron is essential for keeping your immune system strong and responsive. When your body doesn't have enough, it's like your internal army is running low on supplies. That makes it harder for you to fight off viruses, bacteria, and even chronic inflammation. So if you've been feeling under the weather more often than usual, that's another reason to check in with your doctor and bring up the possibility of iron deficiency. What makes all of this especially tricky is how these symptoms can overlap with other conditions or simply be written off as part of aging. But here's the truth. You don't have to accept feeling less than your best just because you're over 60. That's a myth too many people buy into. The truth is, if something feels off, it's worth paying attention to. Your body is wise and it's always communicating with you. The key is learning how to listen. And here's the good news. Iron deficiency is often very treatable. The first step is awareness, recognizing the symptoms and taking them seriously. The next step is getting your levels checked. A simple blood test can tell your doctor a lot about what's going on inside your body. If your iron is low, they can help figure out why, whether it's due to diet, medications, internal bleeding, or problems with absorption, and guide you toward the best treatment. Sometimes that means adding more iron-rich foods to your meals, like spinach, lentils, red meat, or fortified cereals. Other times, it may involve supplements or addressing a digestive issue that's interfering with absorption. And yes, there are gentle, senior-friendly iron supplements out there that don't cause stomach upset. The important thing is that you don't try to fix it all on your own without guidance. Too much iron can be just as harmful as too little, so balance is key. It's also worth mentioning that some medications commonly taken by seniors, like antacids, blood thinners, or certain blood pressure drugs, can interfere with iron levels or mask the symptoms. That's why it's so important to have an open, honest conversation with your healthcare provider. They're not just there for emergencies, they're there to help you feel your best every single day. You deserve to feel alert, energized, and strong, not just okay. And the more you understand what your body is trying to tell you, the more power you have to take action and make choices that support your health and independence. One thing that surprises many people is how mood and emotions can also be affected by iron levels. You might think of iron as something only related to strength or stamina, but your emotional well-being is just as connected. When your body is struggling to get enough oxygen to your brain, it can lead to feelings of irritability, anxiety, or even depression. You may find yourself more short-tempered than usual, or perhaps you've been feeling more down, withdrawn, or emotionally flat without knowing why. It's easy to blame it on stress or just being in a funk, but if it lingers, especially alongside other symptoms we've talked about, it's worth considering that your body might be trying to tell you something. This emotional toll is especially important to acknowledge because it often goes unnoticed. We tend to separate physical and mental health when in reality they're deeply intertwined. A lack of iron can change the way you feel and respond to the world, not just in your body but in your mind and spirit. That foggy, low-energy feeling? It can start to feel like your spark is fading. But it doesn't have to stay that way. And sometimes the signs of iron deficiency aren't in how you feel, but in how you heal. If you've noticed that cuts, bruises, or even general recovery from illness is taking longer than it used to, it might be time to check in. Iron helps your body regenerate cells and carry nutrients to the places that need repair. Without it, your body's ability to bounce back slows down, and that can affect everything from your immune system to how fast your skin or muscles recover from injury. Even something as simple as a sore or swollen tongue can be a signal. Some people with low iron experience burning sensations in their mouth or tongue, or notice that food tastes different. You might think your taste buds are just changing with age, but again, it could be your body trying to flag an imbalance. Every small sign matters, especially when they start to add up. The message here isn't to cause worry or make you feel like you need to obsess over every twinge or ache. It's to empower you with knowledge so you can partner with your body, not work against it. If anything in this conversation has made you think, wait a minute, that sounds like me, then that's already a huge step forward. Awareness is the beginning of change. You don't have to wait until things get worse to take action. Sometimes, all it takes is a simple conversation with your doctor, a basic blood test, and a few adjustments to your diet or routine. And let's not forget, just because something is common doesn't mean it's normal. Feeling tired all the time, struggling with brain fog, or being more moody than usual doesn't have to be your new reality. You deserve to feel good in your body at every age. If you're wondering what you can do right now, start by tuning in. Pay attention to how your body feels over the course of a week. Are you more tired than usual? Do you get winded doing simple tasks? Is your sleep restless, your skin pale, or your mood lower than normal? Don't brush those things off. Make a list. Bring it with you to your next doctor's visit. Let them know what you're noticing. And in the meantime,